Hey there! Today we're diving into the fascinating world of cognitive behavioral therapy, or CBT for short. This powerful form of psychotherapy has been helping people tackle a wide range of mental health challenges, from depression and anxiety to substance use disorders and even marital problems. So, let's unpack what CBT is all about and how it can potentially change your life for the better. At its core, cognitive behavioral therapy is a talking therapy that focuses on the connection between our thoughts, feelings, and behaviors. It's like a mental workout for your brain, helping you identify and challenge negative thought patterns that might be holding you back. The basic premise of CBT is pretty straightforward. Our thoughts, emotions, physical sensations, and actions are all interconnected. When we get stuck in negative thinking patterns, it can create a vicious cycle that affects our mood and behavior. CBT aims to break this cycle by teaching you practical strategies to reframe your thoughts and change your behaviors. One of the coolest things about CBT is that it's not about dwelling on your past. Unlike some other forms of therapy that might have you lying on a couch talking about your childhood for hours, CBT is all about dealing with your current problems and finding practical solutions. It's like having a personal trainer for your mind, helping you build mental muscles to tackle life's challenges head-on. So how does CBT work? Now let's get into the nitty-gritty of how CBT actually works. The process typically involves a few key steps. Step 1. Identifying negative thoughts. The first step is becoming aware of those pesky negative thoughts that pop into your head. You know, the ones that tell you you're not good enough or that everything's going to go wrong. Step 2. Challenging those thoughts. Once you've identified these thoughts, you'll learn how to question them. Are they based on facts, or are they just assumptions? This is where you put on your detective hat and start gathering evidence. Step 3. Replacing negative thoughts with realistic ones. After challenging your thoughts, you'll work on replacing them with more balanced, realistic alternatives. It's not about forced positivity, but about seeing things as they truly are. Step 4. Changing behaviors. CBT isn't just about thinking differently, it's also about doing things differently. You'll learn new coping strategies and behaviors to help you deal with challenging situations. Step 5. Practicing and reinforcing. Like any skill, CBT techniques take practice. You'll often be given homework to help you apply what you've learned in your daily life. So, what are the benefits of CBT? Now, you might be wondering, what's in it for me? Well, let me tell you, the benefits of CBT are pretty impressive. Here are a few benefits. Number 1, it gives you hope. One of the coolest things about CBT is that it can give you hope about your condition. When you're struggling with mental health issues, it's easy to feel stuck and pessimistic. But CBT shows you that your thoughts aren't always accurate reflections of reality. By learning to challenge these thoughts, you open yourself up to new possibilities and a brighter future. Number 2, boosts your self-esteem. Many mental health conditions go hand in hand with low self-esteem. CBT can help break this pattern by teaching you to recognize and challenge negative self-talk. As you start to understand how your thoughts work and how you can control them, your entire belief system can change, including how you view yourself. Number 3, helps you chill out. Let's face it, life can be stressful. But CBT can teach you relaxation techniques and coping strategies to help you manage stress better. It's like having a mental toolkit you can pull out whenever life gets overwhelming. Number 4, develops more rational thinking. One of the main goals of CBT is to help you think more rationally. We all have cognitive distortions, those automatic negative thoughts that pop into our heads. CBT teaches you to question these thoughts and replace them with more balanced, realistic ones. Over time, this can transform your thought processes, helping you respond to difficult situations in a more balanced way. Number 5, improves emotional regulation. CBT can help you become more aware of your emotions and learn healthier ways to manage them. Through techniques like cognitive restructuring, you can learn to think differently about situations and challenge negative thoughts, leading to better emotional control. Number 6, increases self-awareness. As you work through CBT, you'll likely become more aware of your thoughts, feelings, and behaviors. This increased self-awareness can be a powerful tool for personal growth and change. So, how can I get started with CBT? Now, I know what you're thinking. This all sounds great, but how can I actually use CBT in my life? Well, I've got you covered. Here are some CBT techniques you can start trying today. Number 1, thought records. Keep a journal of your negative thoughts. Write down the situation, your emotional response, and the thought that triggered it. Then try to come up with a more balanced alternative thought. Number 2, behavioral experiments. If you have a negative prediction about something, test it out in real life. For example, if you think your boss thinks you're a failure, try asking for feedback on your performance. Number 3, activity scheduling. If you're feeling depressed, try scheduling enjoyable activities throughout your day. This can help boost your mood and energy levels. Number 4, exposure therapy. For anxiety-related issues, gradually exposing yourself to feared situations can help reduce fear over time. Number 5, mindfulness. Practice being present in the moment without judgment. This can help you observe your thoughts without getting caught up in them. Number 6, cognitive restructuring. Learn to identify and challenge cognitive distortions. For example, if you tend to catastrophize, always assuming the worst, practice looking for alternative outcomes. Number 7, problem-solving skills. Break down overwhelming problems into smaller, manageable steps. Number 8, relaxation techniques. Learn and practice relaxation methods like deep breathing, progressive muscle relaxation, or guided imagery. If you're considering trying CBT, you might be wondering what actually happens in a session. Well, let me break it down for you. Step 1, collaborative approach. First off, CBT is all about teamwork. You and your therapist will work together to understand your problems and develop strategies to address them. Step 2, goal setting. At the beginning of therapy, you'll work with your therapist to set specific, achievable goals. These might be things like reducing anxiety symptoms or improving your mood. Step 3, skill building. A big part of CBT is learning new skills. Your therapist will teach you techniques to identify and challenge negative thoughts, manage stress, and cope with difficult emotions. Step 4, homework. Don't worry, it's not like school, but your therapist will likely give you exercises to practice between sessions. This might include keeping thought records, trying out new behaviors, or practicing relaxation techniques. Step 5, progress tracking. You and your therapist will regularly review your progress and adjust your treatment plan as needed. Step 6, time limited. Unlike some forms of therapy that can go on indefinitely, CBT is usually short-term, often lasting between 5 to 20 sessions. The great thing about CBT is that it can be helpful for a wide range of issues. It's most commonly used to treat anxiety and depression, but it's also been shown to be effective for post-traumatic stress disorder, obsessive-compulsive disorder, phobias, panic disorders, eating disorders, substance use disorders, sleep problems, relationship issues, chronic pain, and many more. Even if you're not dealing with a specific mental health condition, CBT can be a great tool for personal growth and development. It can help you become more self-aware, improve your communication skills, and develop healthier coping strategies for life's challenges. Now, for all you science buffs out there, let's talk about why CBT works. Unlike some other forms of therapy, CBT has a ton of scientific research backing it up. Numerous studies have shown that CBT can be as effective as, or even more effective than, other forms of psychological therapy or psychiatric medications for many conditions. The effectiveness of CBT comes from its focus on changing both thoughts and behaviors. By addressing both cognitive and behavioral patterns, CBT can create lasting changes in how a person thinks, feels, and acts. One of the key mechanisms of CBT is cognitive change. The idea is that by changing your thoughts, you can change your emotions and behaviors. This is typically done through a process called cognitive restructuring, where you learn to identify, challenge, and replace negative thought patterns with more balanced ones. Another important aspect of CBT is behavioral activation. This involves engaging in activities that are likely to improve your mood and increase your sense of accomplishment. For someone with depression, this might mean scheduling enjoyable activities or setting small, achievable goals. Now, as amazing as CBT is, it's not a magic cure-all. Like any form of therapy, it has its challenges and limitations, like the following. Number 1, it requires active participation. CBT isn't a passive process. You need to be willing to do the work, both in sessions and between sessions with homework assignments. Number 2, it can be challenging. Facing your negative thoughts and fears can be uncomfortable at first. It's important to be prepared for some emotional discomfort as part of the process. Number 3, it focuses on the present. While this is often seen as a strength of CBT, for some people with deep-rooted issues from their past, other forms of therapy might be more appropriate. Number 4, it may not be suitable for severe mental health conditions. While CBT can be helpful for many conditions, people with severe or complex mental health issues might need more intensive treatment. Results take time. While CBT is often shorter term than other therapies, it still takes time and practice to see results. Don't expect instant changes. If you're considering trying CBT or you're already in therapy, here are some tips to help you get the most out of it. Number 1, be open and honest. The more open you are with your therapist, the better they can help you. Don't be afraid to share your thoughts and feelings, even if they seem silly or embarrassing. Number 2, do your homework. The work you do between sessions is just as important as what happens in therapy. Make time to practice the techniques you learn. Number 3, be patient. Change takes time. Don't get discouraged if you don't see immediate results. Keep practicing and trust the process. Number 4, set realistic goals. Work with your therapist to set achievable goals. Celebrate small victories along the way. Number 5, practice self-compassion. Be kind to yourself as you're learning these new skills. It's okay to make mistakes or have setbacks. Number 6, apply CBT skills to daily life. Look for opportunities to use your CBT skills in everyday situations. The more you practice, the more natural it will become. Number 7, keep a journal. Writing down your thoughts and feelings can help you track your progress and identify patterns over time. Number 8, stay committed. Even when things get tough, try to stick with it. The skills you learn in CBT can be valuable tools for life. All right, folks, we've covered a lot of ground today. Cognitive behavioral therapy is a powerful tool that can help you change the way you think, feel, and behave. It's not about positive thinking or ignoring your problems, but about seeing things more clearly and developing healthier ways of coping with life's challenges. Remember, everyone's journey is different. What works for one person might not work for another. If you're struggling with mental health issues, it's always best to consult with a mental health professional who can provide personalized advice and treatment. CBT isn't just a therapy, it's a set of life skills that can help you navigate the ups and downs of life with more resilience and self-awareness. Whether you're dealing with a specific mental health condition or just want to improve your overall well-being, the techniques of CBT can be incredibly valuable. So why not give it a try? Start small by practicing some of the techniques we've discussed. Pay attention to your thoughts, challenge the negative ones, and see if you can come up with more balanced alternatives. Remember, change takes time and practice, so be patient with yourself. Thanks for tuning in, and remember, your thoughts are powerful. Use them wisely.